in a very tragic car accident on Broad and Banks with a family of 6, a father, mother, grandmother, 2 16-year-olds, and 1 2-year-old toddler. Today we will evaluate and help these patients.
Hello, Dr. Johnson. I'm Nurse Jade. I'm the charge nurse for today. Our first patient from triage is Mr. G. He's a 40-year-old male. He was the driver of the vehicle that turned over. His respiratory rate's 45 a minute. He seems very confused. He doesn't seem like he knows where he is. And upon auscultation, I noticed that on his left lung, he had coarse breathing sounds, and on his right lung, it's absent of breath sounds. So we need to
if they're not videoing, they need to.
First, Nurse G, we will need to insert a chest tube ASAP. Start an IV and a neuro check.
Okay, let's go assess the patient.
Hello, Mr. G. I'm Dr. Nye.
Mr. G, I'm Jade, your nurse. I'm just coming back with the doctor.
Oh, okay. Mr. G, I see you're having some trouble breathing. We're going to put a chest tube in ASAP. We're going to set you up for an IV, and we're going to do a neuro check.
How are you doing, Mr. G?
I can't breathe.
Are you having pain?
What happened? Where am I?
You were in a car accident, and we're at Charity Medical,
Oh,
but
God.
we'll be able to assist you. Can you call
I'm
me?
gonna help you out, okay?
Right.
Nurse Serena, Nurse Casey, okay, you know what's going on in here. So right now I'm gonna need O2 stat. We can start off with 3 mLs. I need a neuro check also. It seems like he doesn't know where he is, doesn't know what happened, doesn't even remember the car crash. His chest tube is just placed, so if you can go in here and check placement of the tube, monitor the drainage, make sure the tube isn't caked up with anything. X-rays on the way soon also, okay? So if we can get this done quickly.
Hi, Mr. G. I'm Nurse Casey. I'm Nurse Serena. Can you give me your name and date of birth? Brian G. All right. What's your birthday? You don't know your birthday? It's fine. I just can. Oh, man.
While she's scanning, I'm going to do a neurovascular check on you, okay? I'm just checking your skin tone.
And I'm just going to give you some oxygen.
From pain on scale 0 to 10, what's your pain right now? Checking your... You got a chest tube? Can you wiggle your toes for me? Yeah? Okay. Can you feel any pressure when I'm pinching your toe? Okay, that's good. So you have circulation down there. All right. I'm gonna do IV on you, okay, just in case if you need any type of medication or anything like that. All right. I'm gonna put the tourniquet on you, okay, so you feel a little pressure, okay. Feel your veins. Okay. All right. I'm gonna clean the site. Get the alcohol away from there. All right. I'm about to get ready to stick, okay. Got my needle. All right, I'm ready to stick, okay? All right, got some blood drawn back. I'm going to continue to insert the catheter. Okay, release the tourniquet. Prop the line.
If it was a he wouldn't have on the knee. He would be barrel.
He would be. All right, IV's done. I'm also going to check your chest tube, okay, that the doctor just put in. I'm just going to check the placement to make sure that it's intact. Also checking the bandage to make sure there's no leakage. I'm going to look right down here, okay, to make sure you don't have anything on this side. Okay, everything looks good. Okay, no swollen, everything looks good. Okay, I'm going to check for residue. Okay, so it's bubbling. And no more than 100 ml of fluid in there. So everything looks good. The hanger right here. It's just low. Okay.
With Mr. G, the doctor started a chest tube due to pneumothorax, which was confirmed by x-ray. He was started on 2 liters of O2. Neurocheck was performed, and all were within normal limits, except for his pain level was at an 8. And his skin was cold and clammy due to lack of oxygen. IV was started at 1,000 dextrose 5.5, normal saline 1,000 over 8 hours.
Dr. Johnson, our next patient was the backseat passenger of the car. He is a 16-year-old male having episodes of hematemesis, which is blood in his vomit. Blood pressure reading is 80 over 70, which is extremely low, and his heart rate is very tachycardic at 130 beats per minute.
Thank you, Nurse Jade. I also need a type of crossmatch ASAP. Then I need to get, I need you all to monitor the blood that is hung. I need you all to get him an ultrasound for the GI bleed if there is.
Okay, and let's go see our patient.
Oh my goodness.
Hello, little G. I'm Dr. Mai.
Hello, I'm Jade. I'm the charge nurse of the ER. How are you feeling?
Not good.
Not good.
No.
Having pain?
Some, yeah.
Okay, I can see you've been vomiting. Looks like some blood tinge.
Yes.
I'll get some gloves out here and get that up.
All right, thank you. We're going to actually do an ultrasound to check to see where this blood is coming from. And we're also going to get you a little blood pain to replenish the blood that you lost.
Hey, get this out of your way.
Thank you, Nurse Jade. I'm actually going to need someone to monitor that blood while it's being.
Oh, my stomach don't feel good.
I know, little G.
Okay, Nurse Serena, Nurse Casey. Okay, our 16-year-old patient. I'm going to need you to start an IV. While doing so, I'm going to need a blood sample and a purple vial because I need to cross and tight match. Also, I'm going to need a CBC. Casey, I'm going to need you to do a neural check. I'm going to need either one of you guys to obtain a stool specimen inside of our cup.
I can do that.
Okay, awesome. And Casey, you can connect him to the EKG. He's tachycardic. We need to monitor that heart rate.
Hi, I'm Nurse Casey.
I'm Nurse Serena. How are you doing today?
Not good. Where are you vomiting? That's my stomach. Okay.
Well, I'm here to get an IV on you to get some blood, okay? And also, I need to get a stool sample from you. So, can you get out of bed and go use the bathroom? I need you to clean this cup for me. Would you be able to do that?
No, can you just give me a bedpan?
A bedpan? Okay, sure, that's fine. All right.
And I'll be hooking up an EKG, but your heart rate is a little high. It's about 130. We're just gonna see if you have anything with that.
While she's doing that, let me start the IV on you, okay?
Okay.
I'm gonna put this tourniquet around your arm. You're gonna feel a little pressure, okay? I'm gonna put the tourniquet back on, okay? All right, I'm ready to stick, okay?
Okay.
Pushing the needles in, get some blood draw back. Proceed with the catheter.
Looks like our patient is AFib. His pulse is going down. It's now 90. And
We're gonna get some blood from you, okay?
are you having any pain anywhere?
My stomach hurts a lot.
Your stomach hurts?
And I'm having a little squeezing in my chest.
On your chest? You want to listen to your heart sounds then.
All right, once she's finished hooking up the EKG, I'm gonna put the bedpan under you to get the stool specimen, okay?
Sounds normal.
Put the bed pan under you. All right, you can turn back.
On this patient, a CBC and a cross match was performed for a blood transfusion. EKG was checked due to his heart rate being elevated and the blood pressure being low at 80/70. A cold blood stool sample was performed. An OR was notified, and he was prepped for abdominal surgery to correct internal bleeding.
Okay, Dr. Johnson, this is our next patient from triage. This is Mrs. G. She was the front passenger of the car. She's actually 24 weeks pregnant with twins. She is a G4, P2. Her chief complaint is abdominal cramping. Baby just is a top priority right now, so we need to get in there quickly.
Okay, so I need you all to check vaginal bleeding. What's her month again?
She's 24 weeks, 6 months pregnant.
6 months pregnant, 24 weeks. I need to get a postpartum assessment, and I'll also need you all to monitor the fetal heart rate to ensure that the fetus is not in distress.
Right. Okay, we need to check out those fetal heart tones then.
Thank you.
Mrs. G, I'm Jade. I'm one of your nurses. How are you feeling?
I'm in pain.
You're in pain? Okay, can you show me where you're in pain? Is it lower, down,
It's
lower?
lower.
Okay, and this is Dr. Johnson. She'll be helping you out also.
Hello,
Okay.
Mrs. G.
Y'all give me something for pain.
Mrs. G,
For
are you
pain.
having any vaginal bleeding?
I don't know.
No. Okay.
On a pain scale from 1 to 10, 10 being highest, what is your pain level?
10.
Hey ladies, we have Mrs. G here. She's 6 months pregnant, G4, P2. First I'm going to need a postpartum check inclusive of bubble heat, check for vaginal bleeding, and document the amount if any. I need you to check fetal heart tones, check the patient's MR, see who is her normal OB, and we need to place a call to her OB.
Hi, Mrs. G, how you doing?
Hi.
I'm Nurse Serena,
I'm Nurse Casey.
and I'm here to do your postpartum check, okay? I'm just gonna check to see if you have any vaginal bleeding. My nurse was telling me that you was having some pain. I'm just gonna check, right down here, and, you don't have to feel embarrassed, okay? I'm just gonna
Go ahead and take your
get you
temperature.
to open your leg. I'm just gonna cover you, okay? Can you lift your leg up for me?
Okay, her temperature is 98.4, which is normal. Go ahead and get her.
Okay, so there's no blood down there, so that's good. When was the last time you used the bathroom? Did you use the bathroom at all to go urine?
No, it feels like I have to go now.
You feel like you have to go now? Okay. Okay, so, do you need a bedpan, or do you want me to help you get up to go? You can't get up? Okay, I can get a bedpan for you, okay? So after you urinate, do you still have any more pain in your abdominal area? It feel like cramping? Okay. So we're gonna get the medicine ready for you, and we need to put the fetal heart rate monitor on you, okay, to make sure the baby is sleeping.
Okay, Mrs. G had an ultrasound performed, fetal heart monitor was placed to check on the baby's heart rate and ensure that the baby was safe. It was placed on the abdomen. She started to have contractions. OBGYN was notified and a phone order was given and read back to confirm under the order. 4 grams of magnesium sulfate was administered over the first 15 minutes and then 2 grams per hour.
Okay, Dr. Johnson, here we have the twin sister of our twin 16-year-old male boy. Okay, and she was also in the backseat of the vehicle. Her vitals are stable, but she is complaining of pain. She has broken glass along her left forearm. It's covered in blood, by the way. There's no major organ or vessel damaging to the arm or anything like that. Just preventing and avoiding infection is our top priority.
Sure, no problem. So I'll take that glass right out. I'll get some lidocaine to numb it. Thank you, nurse. We also need to get a tetanus shot administered and I need to push some antibiotics.
Okay, Nurse Tina, Nurse Brandy. Okay, Dr. Johnson ordered IV piggyback vancomycin. The drip rate is going to be 30 mLs an hour. We're going to need one of you guys to administer a tetanus shot because we're trying to prevent the Clostridium tetani, any kind of bacteria. We're just trying to prevent infection here with all this glass in her arm. Brandy, you can start giving her a lidocaine shot because Dr. Johnson is going to remove that glass ASAP on it. I mean, it's bleeding profusely. We just gotta control that bleeding, prevent all infection. Oh, I'm in so much pain.
How are you doing, Miss Little G?
I'm hurting so bad. It hurts so bad.
Okay, so me and Nurse Brandy, we're gonna get this glass off for you. She's gonna administer a little bit of lidocaine to numb you up.
Oh my God, is that gonna hurt?
It's just gonna be a nice little pinch.
Oh, okay, it hurts so bad. I don't need no more pain. No, I don't like needles. Get away from me. I don't like needles.
Little Miss G,
Get away from me. Get away from me.
calm
I don't like needles.
down.
You're freaking me out. Are you gonna help me or are you gonna hurt me?
I'm gonna help you. If you want, take a deep breath and look that way, okay? Okay. 1, 2, 3. Okay, it shouldn't hurt anymore.
Who are you?
Hi, I'm Tina, your nurse. I'll be working with you today. I came to get you some antibiotics to keep you from getting infection. Okay. And I came to give you also a tetanus shot. It's also going to help you from that glass to make sure that you
Are you gonna
Don't get
take the
any
glasses
infection.
out of my arms?
know I won't, but
I can't feel my arms. See this? I can't
the
feel
doctor
my
will
arms.
come back and to make sure that everything is fine.
It hurts.
I'm gonna scrub the hub, wipe this off for 15 seconds. And I'm gonna connect the antibiotic for you.
Oh, it burns. Can you take this off? It's burning.
Oh. It's gonna be a little stick. This is for your
Okay.
tetanus shot. I'm gonna
I
draw
don't
back
like needles.
to make sure there's no blood going into the muscles.
Ow, that hurts.
Okay.
That's it?
Yes, that's it.
Okay.
His twin sister, Little G, was given a tetanus shot via IM injection. An x-ray was performed. Antibiotics were started to prevent infection. The doctor performed the surgery where lidocaine was administered to the site to numb before removing the glass. The doctor performed the initial wound dressing and the nurse would change it thereafter.
Okay, another patient who was in the backseat of that car accident is Brandy G. She's a 68-year-old female. She is here from triage. She is stable. Vitals are stable also. She is diabetic and blood sugar is 550.
Okay, so I'm gonna need an AccuCheck, a urinalysis, also an insulin injection. Please check her glucose levels, and we also need a neuro check. Oh no! Oh my goodness!
Oh no,
Brandy G.
Oh Lord. Oh Lord,
Please turn around this way.
Oh Lord, y'all help me, please, up there. I'm trying to get home. Oh Lord. Oh Lord, y'all.
Are you okay to stand up, ma'am? How are you? Let's straighten out these legs.
Yeah, let's get those together.
Oh Lord, thank you, darling.
Okay.
Oh Lord.
1, 2, 3.
Oh Lord.
Let's help with this.
I was trying to get home, y'all.
Okay, no, you can't go home.
Let's swing those legs
Wait.
around.
I need to go home and see my wheel of fortune, y'all. My young and restless is
Wheel
dead.
of
That's not important
fortune.
right now, ma'am.
Oh Lord, child.
We're gonna send some nurses in here to get some help for you, okay? I'm Jade. This is Dr. Johnson, okay?
We'll be right back with you.
Stay still. Let's make sure.
Just like my grandbaby.
How you doing? I might be your grandbaby.
Oh, okay.
We're gonna do a AccuCheck on you. And depending on how your blood sugar is looking, we're gonna give you a little insulin.
How are you feeling? Do you know where you are?
Oh, I'm in the. I'm glad we got my food this morning. I told you I was ready to go home.
Okay, are you in Charity Medical? Do you know?
I'm at Cherry.
Do you know the year?
It's 2015.
Okay.
I just need to go home.
All right, I'm gonna send some nurses in here and they're gonna do a glucose check on you, okay?
Okay.
And I'm gonna need a urine sample also, okay? All right, so
And Granny, stay in that bed, okay?
Okay. Oh, I just need
excuse
to
me,
go.
I don't wanna hit your arm. All right. Or you say it needs AccuCheck. Depending on the AccuCheck, you can administer the insulin injection according to our sliding scale. We're also going to need a urinalysis, so I have a urine specimen cup over here on the table. And after we do that glucose injection, about 30 minutes later, let's get another AccuCheck just to make sure that her glucose levels are stabilized, okay? All right, thank you, ladies.
Hi, good evening. I'm Tina, the nurse there. I'll be taking care of you. I'll be checking your blood sugar and giving you insulin.
Okay, child.
Can you give me your name? Tell me your name and your date of birth.
Betty G.
Okay, Miss
12,
Betty.
18, 32.
Okay, Miss Betty.
What you doing, child?
Ma'am,
What you say you doing?
I'm going to check your blood sugar and give you your insulin if you need it.
Yeah, you do. Ooh, 550.
550, yes ma'am, so I'm going to give you your insulin.
That's really high. I need to stay off them cakes.
Okay, that's it.
After Granny was found on the floor, the nurses determined that her she was still oriented. She did not injure herself. No head injuries. An AccuCheck was done and determined that her blood sugar was 550. And after a second nurse verified the amount, her insulin injection was administered.
Hey, Dr. Johnson, this is our last patient who was also in the same car, the car accident. He actually broke his left wrist. He's a 2-year-old male, and he's having a lot of pain, so I think we need to go check it out.
Okay, so we're gonna give him 5 mLs of acetaminophen. We're
For
gonna
that
actually,
pain.
for the pain, we're gonna actually give him a little ice, and we made plenty, and we're gonna send him to get a cast.
Okay, well, let's go check it out.
G.
Hello, baby G. I'm sorry. Can we see that wrist? Well, it's actually on this side.
So this is okay. Do you want to play with my stethoscope? Oh, okay. That's totally fine.
If we can have some of the parents come in here and help us out, maybe that'll make it easier.
What is this? Oh, okay. That's not. Oh, okay.
It's not there.
Okay. That is not there. Baby G.
I know it's hurting a lot. Can we see? Maybe can we get mom in here help us out? Maybe mom.
Hi, I'm the aunt.
Okay. Well, maybe I can make it a little easier for us. It's okay. Baby G, can we see that wrist?
Okay, let me come around and see that.
Yeah, Doc, come check.
Okay. Oh, it looks pretty.
So, you think we're gonna need that cast, right?
Yes, no slip of the wrist for you. We're gonna actually get that cast ordered. We're gonna split it, and we're gonna give Baby G 5 mLs of acetaminophen. Baby G, we're gonna make sure you feel all bad to her.
Okay.
Oh.
all fixed up, baby G.
X-ray of baby G's wrist.
Okay, we just got our x-rays back, and it has shown that baby G has fractured his left side of the radial bone. We can get some ice on that wrist. We can admit it. Dr. Johnson ordered pain meds. It's just children's Tylenol, oral suspensions, 5 milliliters, Q4 hours, orally, obviously. And after that, we're going to have to get mom in here just to calm baby down a little bit, less anxiety. And let's send off baby to Cass. Now, Aunt is here also, so maybe she'll go instead of mom. Mom seems a little freaked out right now, you know, so that'll be helpful. And here's that ice pack. Let's get that on there. Oh, okay, there you go. Thanks.
Hi, I'm Tina. Hi, baby G. I'm Tina. I'm your nurse today. You're the aunt. How you doing? Okay. So I came to give this Tylenol for pain. 5 milliliters. Okay. Okay, you want to give it to him? Yes, you can. You know, just stand here and watch it and make sure you get it.
So we do that one, okay?
Okay, thank you. So, baby G, the rest of your arm right here so I can put some ice on it and it's help you feel a little better. And I'll come and check on you in a few minutes.
A 2-year-old baby G was given an x-ray to view the broken wrist. He was brought down to have a cast placed on his arm, and age-appropriate activities were brought to his room to keep him occupied. The aunt was at the bedside since the parents were still in triage, and children's Tylenol was administered for the pain.
Oh my God, she's falling and she can't get up.
This is Life Alert. Do you need help, ma'am?